Dr. Seldin, talk about some of the clinical trials that you're using here at Boston Medical.
You know, one of the things that's been a tremendous advance in the field, we've gone from a period where the only treatment we had was low-dose oral chemotherapy, which was minimally effective for this disease. As we talked about, beginning in the mid-1990s, we started the high-dose chemotherapy and stem cell transplant and got much better results in terms of hematologic remissions and actual improvement in the function of organs. We were finally able to see that kidneys and hearts and livers could heal up from the damage caused by the amyloidosis, the protein deposition disease. However, as Dr. Sanchorawala had mentioned, the patients have to be selected very carefully to go through aggressive treatment. They have to have good cardiac function and other parameters that we look at very closely, because we don't want to take patients through a therapy that's going to be highly morbid or have a high mortality rate. So only less than half of the patients we see actually are candidates for that. And we've been very pleased that in the last 8 to 10 years, a number of additional drugs have come along for treatment of plasma cell diseases like amyloidosis and myeloma. We've been able to take tremendous advantage of that for our patients, offer them kind of a menu of options, and really tailor the therapy to the patient in a very personalized and individualized based on their condition, their symptoms, their preferences for treatment, and through trials to test those drugs, we've really been able to identify the right doses to use, safe doses, and combinations of drugs that work best for our patients.
It's wonderful that at least the patient has some input into the type of treatment that they're ultimately going to undergo.
You know, I think, you know, the reason that we focus a lot on clinical trials is it's really a way to test and look for more effective treatments for disease. And we greatly appreciate patients' participation in clinical trials. We don't want patients to fear clinical trials. They're not getting things that have not been extensively tested in other settings and animals and most likely other patients. And clinical trials these days are very, very rarely making use of a placebo. So almost everybody that gets treated on a clinical trial at our center for this disease or other diseases is almost always getting some form of effective treatment. It's not that patients are getting sugar pills or water infusions for treatment, but it really is a way for patients themselves to get new treatments and also really to benefit others and help us learn what the best treatments are for patients' diseases.
You are both involved in a study that was done here at Boston Medical Center on 421 patients who underwent the stem cell transplant combined with the high-dose chemotherapy. I wonder if you would share what you think are some of the pertinent findings of that study.
So that study actually, you know, enrolled patients from 1990 on a different clinical trials. You know, it was a combination of different clinical trials where 421 patients were enrolled from 1994 to 2011, and these patients were treated with AL amyloidosis, were treated with high-dose chemotherapy and stem cell transplantation. And what we found was that the response rates, complete hematologic response rates, were about 40%. About 30 to 40% of patients achieved a partial hematologic response in addition to complete hematologic response. And the survival was significantly better than, you know, what used to be in the past of about 6 years or so. And majority of these patients who have achieved a remission remain in remission, with very, very small number of patients relapsing even, you know, as long as 12 years later.
Just a wonderful contribution. Dr. Seldin, I wonder if you might explain the disease of amyloidosis and how it goes to different organs and your findings in the study with respect to organ response.
So that's the big challenge for patients with amyloidosis. Not only do they have a blood disorder, but they actually end up with impaired organ function, because proteins produced in the bone marrow circulate through the blood and get deposited in organs and damage them. And that generally is what leads to the diagnosis, because the patient is beginning to develop symptoms of heart failure or kidney failure or liver problems or neurologic problems, and that's kind of what brings them into the doctor, and generally how the disease is found. When we take patients through stem cell transplant or other treatment for these diseases, we're trying to kill off the factory inside the bone marrow, and we're hoping and expecting that organs will respond and heal up afterwards. And if the disease is diagnosed early enough, that is the case. Patients can go back to normal organ function, normal activities, and a normal life after that treatment. One of our priorities and one of our goals, and one of the reasons we appreciate your programming about this, is that it's extremely important that patients get diagnosed early. So Dr. Sanchorawala and I and other members of our program travel around the country. We talk to doctors, we talk to patient groups, and we really try to promote early diagnosis so that patients have options for treatment before they suffer from organ failure due to the proteins accumulating in the organs.
You must then see patients that are so advanced in the disease that it limits their options.
That is the case. So sometimes patients come to us where their options are very limited. We actually have a very innovative program with colleagues at Massachusetts General Hospital, where very selected patients can actually be considered for heart transplantation if their hearts are badly damaged by the disease. And if that works out, they can come back to us for stem cell transplantation afterwards. So it's a very effective collaboration between our two hospitals. We talk every week. We send patients back and forth and, again, try to help patients get to the best treatment for their disease.
This excerpt is brought to you by the Massachusetts School of Law, the leader of reform in legal education and the leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.